Welcome to the New York Presbyterian Weill Cornell Medical Center Kidney and Pancreas Transplant Program. Today we will introduce you to our transplant and living donor program and review the basics of kidney donation. This presentation is also available on our website for you to view at any time. We hope you find this presentation interesting and informative. We'll start with the background of our transplant center. We are proud to be the highest volume kidney transplant center in New York. In 2019, we were number 1 for living donor kidney transplants in New York and number 4 for living donor kidney transplants in the United States. We are a Medicare-approved transplant center. As you can see in the graphic on the left, our program has performed almost over 200 kidney transplants every year since 2007. And most recently, we're performing more than 150 living donor kidney transplants per year. The mission of our transplant program is to maximize opportunities for transplantation for all of our patients. If there is a way to safely transplant someone, we will find it. There are many benefits of having a transplant compared to starting dialysis or remaining on dialysis. Kidney transplantation is associated with a big improvement in quality of life compared to dialysis. This is due to the freedom from dialysis treatment, a less restricted diet once the transplant kidney is functioning well, and an overall improved sense of well-being. Transplant recipients often comment about feeling better very quickly after the transplant, even though they just had surgery. A very important benefit is that a patient's survival is much improved after a kidney transplant, specifically a living donor kidney transplant versus a deceased donor transplant, because it improves patient survival compared to remaining on dialysis. There are 2 different types of donors. Donors can be deceased or living. Deceased donors are individuals who pass away and have previously registered to donate their organs. Live donors are individuals who choose to have one kidney removed to give to someone in need. Kidneys from living donors typically last longer than those from deceased donors. A kidney from a well-matched live donor can last 26.6 years, and a kidney from even the best deceased donor may only last 14.7 years. So why would someone choose to donate their kidney as a live donor? First, recipients of a live donor kidney have better success rates than recipients who receive a kidney from a deceased donor. As mentioned, these kidneys usually have a longer lifespan. Secondly, patients who receive a live donor kidney have a shorter waiting time. Wait time on the deceased donor list in New York is up to 8 to 10 years. Having a living donor allows for a transplant to occur once the recipient and donor are cleared to proceed, which usually takes a few months. This surgery takes place on a scheduled date when everyone is emotionally ready, as opposed to a deceased donor transplant, which can happen in the middle of the night. Another advantage of living donation is the possibility of a preemptive transplant, which is when you have a transplant before you start dialysis, and is associated with better outcomes. Finally, there is also the emotional gain for the donor, knowing they have helped improve the life of a family member, loved one, or a total stranger. When learning about donation, you will hear the term compatibility used often. There are 3 types of compatibility that are important: blood type, antigen matching, and cross-matching. Blood type compatibility follows the same rules as blood transfusions. For example, a person with type A blood can receive a kidney from a donor with type A or O blood. A donor with blood type O can receive from other type Os. Type Os can donate to any blood type, which is why O donors are called universal donors. Conversely, a recipient with type AB blood can receive from any blood type, making them the universal recipients. The second type of compatibility we look for is HLA or antigen matching. Antigens are unique markers on the surface of our cells that we inherit from our parents. They help our immune system recognize foreign cells, such as those from a transplanted organ. There are 6 antigens that we try to match in transplantation, although thanks to the anti-rejection medications available today, matching is not critical to the success of a transplant. Although a perfectly matched kidney or a 6 out of 6 match typically does better than other kidneys, a 0 out of 6 match transplant also does well. Many of our transplant recipients have a 0 out of 6 match, and they go on to do very well after transplantation. The last step in assessing compatibility is to perform a cross-match. A cross-match is a test where the blood of the recipient and the blood of the donor are mixed together to see if there is a reaction against the donor. We want a negative cross-match, which means there is no reaction. If there is a reaction, it's called a positive cross-match. It means the recipient has developed antibodies against the donor's antigens. When antibodies are present, it does not mean the transplant cannot occur. It just means that we have to see how strong the reaction is, and then see what the options are. There are options available when there is a blood type or cross-match incompatibility between a donor and a recipient. You can choose to participate in a donor exchange program, which allows incompatible donor and recipient pairs to join a registry of other incompatible pairs. In partnership with the National Kidney Registry, New York Presbyterian Weill Cornell has been able to transplant over 75% of our incompatible donor and recipient pairs. For a positive cross-match or blood type incompatibility, there are medications and a treatment called plasmapheresis, which can decrease the amount of antibodies and possibly allow the transplant to occur. If these treatments fail to reduce antibody levels sufficiently, patients do have the option to wait for a deceased donor transplant. The Kidney Paired Donation/Paired Exchange Program. Approximately 1/3 of patients that need a kidney transplant who come forward with potential living donors will be incompatible with their donor or donors. This means a large number of people that need a kidney and have a willing but incompatible donor. Our solution is to enter the incompatible donor and recipients into a larger pool of other incompatible donor and recipient pairs. Then patients are matched to donors with whom they are compatible. The graphic on the left features a very simplified version of the donor exchange. In reality, large change of transplants can be created through paired exchange. One benefit to the paired exchange is that the recipient avoids the additional therapy needed for positive cross-match or ABO incompatible transplants. Compatible pairs and paired exchange. Here are a few reasons compatible pairs may choose to participate in the paired exchange program. Number one is to find a better HLA match through the paired exchange. As we know, an improved HLA match between the donor and patient may increase the chance that the transplanted kidney will last longer. Number two, to avoid donor-specific antibodies, also known as DSA. For example, a daughter wants to donate to her mother, however, the mother has DSAs against the child's paternal antigens. These DSAs can negatively impact the transplant outcome, so they choose to participate in paired exchange to find a transplant without antibodies. Number three, to find a better age match for the recipient. For example, a grandson wants to donate to his grandmother. He is 25 and she is 70. They enter paired exchange so someone younger can benefit from receiving his kidney, while the grandmother can receive a kidney from a donor closer to her age. Number four, altruism. Donor is blood type O and recipient is blood type AB. They enter paired exchange so that someone with blood type O can receive this donor's kidney, since the recipient can receive a kidney with a donor with any blood type. The Advanced Donation Program. This unique program enables donors to donate their kidney before their intended recipient receives a transplant. We work with the National Kidney Registry to achieve advanced donation. Some sample scenarios are when donors have specific time constraint or donors who are primary caregivers for the recipient, as this gives them time to recover prior to the recipient receiving a kidney. ADP donors also maintain integrity of a swap should their intended recipient become ill and unable to move forward at the scheduled time. For example, a donor would donate at the scheduled time and the recipient would receive prioritization for a kidney once they are recovered from their acute illness. Next, there are voucher donors. They are similar to ADP donors, except the intended recipient does not yet need a kidney. For example, an aging parent who knows that their child will likely need a kidney transplant in the future, or has a functioning transplant now and will likely need another transplant in the future. The parent can donate a kidney now, providing a voucher for their child to receive a living donor kidney transplant when, if needed, in the future. Options for non-directed donors. Non-directed donors are also known as altruistic or Good Samaritan donors. They have several options. They can participate in the kidney paired donation program, or they can donate to a transplant candidate who is on the waiting list for a deceased donor kidney. If other options are available, the potential non-directed donor will be notified. For those that serve as a non-directed donor with the National Kidney Registry, there are a couple other options. A program called the Family Voucher Program is available, and this allows non-directed donors to nominate up to 5 family members as voucher holders. Voucher holders do not need to have any signs or symptoms nor risk factors for kidney disease. Prior to the donation, consent forms must be obtained from the potential voucher holders, and they must complete a cheek swab for genetic profile within 90 days of the donor's kidney donation surgery. This genetic profile will serve as the voucher holder's unique identifier should they need to redeem the voucher in the future. Now, let's talk about how you can become a living kidney donor. First, the potential donor needs to contact our Living Donor Center. We'll ask you to complete a registration and medical intake form on our donor screening website, cornell.donorscreen.org. This form is then reviewed by a transplant coordinator, and you will receive a call letting you know if you are able to proceed with the next step. If you are able to proceed, we will schedule an appointment for you to come in to the Living Donor Center for your initial evaluation. During the initial evaluation, you will meet with a living donor coordinator who will review your medical intake form with you, and you will receive education about what it means to be a living kidney donor. During this visit, you will also have your blood drawn to determine compatibility, which was discussed earlier. The results of these tests take about 2 weeks, and once available, the donor team will contact you to inform you of the results. If applicable, we'll advise you about the next steps you will need to take if you'd like to move forward with the evaluation process. Please note that it's your responsibility as the potential donor to inform your recipient of the test results, as these results are confidential and the donor team is not allowed to release it to the recipient. Once the results are given, you, as the potential donor, are able to ask questions regarding your levels of compatibility and discuss your willingness to continue with the next step. If more than one donor is being tested, you may want to wait until everyone has their results before deciding who would like to move forward with the next step, as only one donor can move forward at a time. If a donor is identified that would like to proceed, that person contacts their donor coordinator to schedule the medical evaluation. The medical evaluation consists of a full day of testing. During this evaluation, you will meet with members of the living donor team, including your donor coordinator, who will take you through the education and informed consent process, your nephrologist or kidney doctor, social worker, an independent living donor advocate, and a financial coordinator. You will also meet with the dietitian and psychiatrist if the donor team feels you may benefit from these visits. Blood work, an EKG, a chest x-ray, and a CAT scan of the abdomen and pelvis are also performed at this visit. You will also be asked to bring a 24-hour urine collection, which is collected the day before at home. Radiographic evaluation. The CAT scan or x-ray is performed to assess the size and function of the kidneys and to look at the blood vessels supplying blood to and from the kidneys, which help determine which kidney would be most suitable for donation. Most kidneys work equally and have the same number of vessels. Usually, the left kidney is chosen for donation. If unequal, further testing may be performed to determine which kidney is higher functioning, and that kidney stays with the donor. During your visit with the social worker, you'll be asked questions to ensure that you are not feeling pressure or coercion to donate your kidney. You'll also be asked questions to assess for psychiatric illness and substance abuse issues that may make you ineligible to donate. You'll also explore the emotional aspects of donation and how it can impact you during the process and after donation. And we will ensure that donation will not negatively affect you financially. Results of the medical and psychosocial evaluation are given to you by phone within 1 week. In addition to the testing performed at the medical and psychosocial evaluation, a pap smear is required for females over 21, a mammogram for females over 40, and a colonoscopy for anyone over the age of 45. It is helpful to bring copies of results with you the day of the evaluation, but these tests do not need to be done before the evaluation. Additional testing such as a 24-hour blood pressure monitoring, cardiac testing such as an echocardiogram or stress test, or other tests may be deemed necessary by the living donor team. If you are cleared to proceed with donation, keep in mind that your intended recipient must also be cleared by his or her team before a surgery date can be given. While considering live kidney donation, you should understand that you will have to take time off from work. The average time donors take from work is 2 to 3 weeks, depending on their job duties and recovery process. Begin thinking about this and discuss it with your employer. Health and life insurance companies may consider you to have a pre-existing condition after donation, which could lead to coverage issues. You should clarify and, if necessary, optimize your health insurance prior to donation. All testing pertaining to the compatibility, medical testing, and surgery are covered by your recipient's insurance. You will use your own insurance to fill prescriptions for pain medications after donation upon discharge from the hospital. Donors are required to have health insurance or access to health care to move forward as a donor at Weill Cornell. We feel this is important for your own health and well-being. If you do not have health insurance, the social worker and financial coordinator will assist you with possible options and provide available resources. Pre-operative visit. Once both the donor and recipient are cleared to proceed and decide to move forward, a surgery date is set. A pre-operative visit occurs about 1 week before surgery and involves meeting your surgeon to review the surgery itself and sign the consent form. You will also meet with your donor coordinator to discuss pre-operative instructions and your social worker to discuss your support plan. You will also have pre-operative blood drawn and you'll register with the operating room. In preparation for your surgery, you will be asked to discontinue the use of ibuprofen and aspirin for 1 week prior to surgery. The day before surgery, you may eat a light breakfast and lunch, followed by a liquid diet after noon. Nothing may be eaten or drunk after midnight and the morning of the surgery. Also, the day before, you will need to drink half a bottle of magnesium citrate, which is available over the counter at a pharmacy. In summary, you should expect to come to the Living Donor Center for 3 visits, which include your initial medical screening and blood work, your medical and psychosocial evaluation, any additional visits depending on the outcome of your medical evaluation, and lastly, your pre-operative visit. Now that we've covered the evaluation process, let's talk about the surgery itself. At Weill Cornell, we use laparoendoscopic single-site approach to removing the kidney. Weill Cornell has the largest national experience with this type of surgery, which uses just 1 incision to remove the kidney. This 2 to 3 inch incision can be hidden in the umbilicus or belly button. The advantage of this type of living donor nephrectomy is that it results in fewer incisions, leading to less scarring and a quicker recovery period. The surgery is performed under general anesthesia and lasts 1 to 2 hours. The donor then goes to a recovery room for about 4 hours and then stays in the regular hospital room for 2 days. The complications of surgery are less than 5% and include bleeding, blood clots, infection, nerve damage, and reoperation. As with any major surgery, you should expect to experience pain from the incision site. While in the recovery room after surgery, many donors will receive TAP, transverse abdominis plane block, which is a peripheral nerve block designed to anesthetize the nerve supplying the anterior abdominal wall. The TAP block is designed to help with the pain of surgery and decrease the use of narcotic pain medication. You are given pain medication through an IV for 24 hours, and then oral pain medications for the remainder of the hospital stay and at home. The post-operative period usually consists of 2 days in the hospital. On the first day, you will have the bladder catheter removed, be able to walk around the hospital floor, and have a clear liquid diet. On the second day, you should be advanced to solid food and discharged home if you are feeling well enough. Since everyone recovers and feels things differently, there is no such thing as a typical recovery. Frequent post-operative symptoms include tiredness and fatigue, difficulty sleeping, diminished appetite, pain at the incision site, and sometimes gas pain in the stomach, chest, or shoulders, and stomach upset, bloating, and/or constipation. Restrictions include no lifting more than 10 pounds for 4 weeks and no driving for 2 weeks. You can return to work 2 to 3 weeks after discharge, depending on the type of job. After donation, you will follow up with the surgeon 2 weeks after surgery. You will also follow up in the clinic for blood pressure monitoring and blood work at 6 months after donation, 1 year, and 2 years after donation. You should continue to see your own physician yearly for routine physicals. Donors living out of state or the country may need to use their own insurance for follow-up. What is the long-term risk of donation? Studies have shown that donors have a normal lifespan and that a health status that is similar to that of the general public. We expect to see 25 to 35% decrease in a donor kidney's function. The risk of developing kidney disease is similar or slightly higher, and African Americans and Hispanic donors may have a higher risk than other ethnicities. For this reason, it is important for donors to decrease their risk of developing things that can cause kidney disease, such as high blood pressure and diabetes. We recommend maintaining a good diet and a healthy weight, as they are extremely important long term, as well as seeing a primary care provider to have blood pressure and labs checked at least once every year. The benefit derived by donating a kidney to someone is a very personal understanding that cannot be known by anyone other than the person that is donating or has donated. Each donor's motivations may vary greatly, and each donor has a unique experience as they go through the journey of donating. Studies show that kidney donors tend to have higher quality of life scores after donation as compared to the general public. This may be related to an increase in self-esteem and an increased sense of well-being. Donors also have similar or improved psychosocial health after donation. If you wish to speak with someone who has donated their kidney at our center, we have many donors who are available to call or meet with you to discuss their personal experience with the evaluation, donation, and recovery process. We hope this presentation was informative and answered many of your questions about being a live kidney donor. For more information and to view this presentation, please visit our website at weillcornelltransplant.org and click on Living Kidney Donation, which will take you to the Living Donor Kidney Center section of our website. Thank you for your participation.